Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, a podcast from the front lines of politics in Florida. I speak with Dr. Lisa Gwynn, the current president of the Florida chapter of the American Academy of Pediatrics and an associate professor of clinical pediatrics and public health sciences at the University of Miami Miller School of Medicine. Dr. Gwynn was recently fired from a state board for advocacy for vaccinating children to protect them from COVID-19. Dr. Lisa Gwynn, thank you so much for joining me on Public Health on Call. Could we just start by hearing a little bit about your background and career?
Sure. So I'm a general pediatrician, born and raised in Miami, Florida. I went to medical school here. I trained here at the county hospital. And after my training, I practiced in private practice for almost 9 years, and then decided I wanted to go back into academics and public health. And so I returned as a faculty member at the University of Miami, where I lead community-based pediatrics programs. I run a pediatric mobile clinic program, which provides comprehensive health care to uninsured children throughout Miami-Dade County. And then I also lead school health in the University of Miami and in Miami-Dade County public schools. So definitely out there in the community every day.
And you're the president of the chapter of the American Academy of Pediatrics?
I am. I assumed that role almost 2 years ago. And yes, I've been involved with the Academy in just different capacities, including, a lot of committee work, in the areas of school health and telehealth and immigrant health, all of those, areas in which I practice, where my clinical practice lies.
And so how many pediatricians are part of that chapter in Florida?
We have a little over 3,000 pediatricians and pediatric subspecialists. And so, it's a large organization. We're expanding. Last year we won the very large chapter award from the Academy for all of our work with our members and with the community. So it's an up and rising chapter, a very large chapter, and lots to do, not just with programming, but also with advocacy, especially in the state of Florida.
So, I think it would be fair to say that you yourself have cared for thousands of children in Florida, but also through your work, you have worked directly with pediatricians who've cared for hundreds of thousands or even millions of children.
Yes, absolutely. And I also have been fortunate to interface with a lot of the behind the scenes agencies, the heroes behind the scenes in the public health space. Helping to care for and deliver services to the underserved. Again, in my role at the University of Miami, in the clinical programs that we provide, oftentimes we rely on one another to be able to provide the services that are needed for underserved children.
So I want to ask you about Florida and children and the pandemic, because it's been a bit of an outlier state.
Yes, that's to say it lightly. We've had a rough 2 years here, and it's transcended across every imaginable, political challenge that seems to be, in the narrative these days. It started with testing. We had a hard time with testing children for COVID. Our mobile units were one of the first in the state to have an allocation of tests to be able to go out and test children. And then, of course, it transcended over to masking. And so we had to fight that fight with masks in schools. And, a lot of our members, including myself, would serve on medical advisory boards for the superintendent of our schools. Yeah. And, it's been, then it, of course, once the vaccine became available, it transcended to vaccines. And so that's kind of where we're at right now in this latest challenge that we've been facing in Florida, and that's related to vaccines.
Could you talk a bit about the Surgeon General of Florida and his position on vaccines for children?
So since the new Surgeon General was instated, prior to this current Surgeon General, we had a pediatrician at the state, as a Surgeon General, Dr. Scott Rivkees, and we felt really good at that time. Like, even though the governor kind of was going rogue in this pandemic early on, we kind of felt a little bit of reassurance that having one of our colleagues at the helm would be a good thing. But in fact, his voice was definitely tampered, and he was, able to accomplish some things in the background, but for the most part, it didn't go as well as we had hoped. And so when this new Surgeon General came into the spotlight, and we found out very early on that he was going to continue basically the narrative of anti-vax, anti-mask, everything that we were trying to, push forward with, these mitigation measures that we knew were important in protecting the health and safety of children and families and the public in general. He was going against it. And so, it became clear that this was going to be a fight on a whole nother level.
We did a podcast a while ago with the medical director of the Johns Hopkins Children's Hospital down in Florida, talking about how many kids were getting sick with COVID. I imagine that the pediatricians you work with have seen some very serious cases and even some deaths.
Definitely. I mean, and this is something that we need to continue to push forward to the media and to the community, because I just don't think that parents are getting the clear message that this can be very serious for children. And it's so bad now here in Florida with regards to the misinformation that the Surgeon General and the governor has put out there regarding vaccines. Even my own nurses, when we were able to secure the vaccines for the under fives, they actually thought that it was against the law, and they pushed back on administering the vaccines in the very beginning when we received our shipments. So, imagine my nurses feel that way, and they're in the healthcare field. Imagine what parents are going through, especially those parents that may not have the health literacy that other, parents from well-resourced communities. So, we have that misinformation that we're now dealing with. And, in Florida, we've had low vaccine rates overall with regular childhood vaccinations. So this is just added fuel to the fire.
So right now, what people are hearing from the Surgeon General with respect to COVID vaccination of children is what message?
The message is that healthy children do not need to receive the COVID vaccine. And so, imagine that's clearly not what science is indicating, what standard of care, we are wanting to provide our parents with accurate information. And so this misinformation is out there. So it's causing a lot of confusion. So much so that my own nurses were kind of frightened to give the vaccine for under fives because that information is out there. So it's challenging. I mean, we've already had a challenge with uptake of the COVID vaccine in younger in the 5 to 11s. And so, that's what we're up against now.
Now, tell me a bit about your experience serving on this board in Florida.
So I was just selected to serve on this Florida Healthy Kids board, and this board or corporation, if you will, is responsible for oversight of CHIP-funded health insurance for kids throughout Florida. It's called Kid Care, Florida Kid Care. And so I had just started serving, actually. I attended my first meeting in March. we felt like it was a win-win for both entities. I mean, I represented the Florida chapter, the AAP, and also, my experience in underserved communities and caring for, kids that are most vulnerable. I felt like I brought a really good, accurate and realistic perspective. And then, of course, representing pediatricians across the state, ensuring that the payment models were in place that would allow pediatricians to continue to take care of these kids. So, if things were going fine. And then suddenly I received an email randomly out of the blue that said that my services were no longer needed.
It's hard to imagine a more qualified pediatrician for a committee like this in the state of Florida after hearing all the things that you have done in your career and are doing now. Why do you think they sent you that letter?
Because of what had happened in Florida with this most recent situation where the governor and Surgeon General decided not to pre-order the COVID vaccine for kids under 5. So we had that happen. And then, of course, behind the scenes, in fact, that wasn't the case. We were going to be able to order the vaccines, but they just put out this false narrative to be honest, I think to just give themselves some publicity. But whatever the case may be, we got through that. And then the following week, they made the decision to not allow local health departments to carry the vaccine. And that's when we really pushed back. Because it became very apparent early on. And again, because of the work that I do out in communities and how closely I work with my local health department, with distributing the vaccine, this became a really big issue for us. And so I think that it just somehow they saw some of the press that was out there and they felt like that was what they needed to do to I don't know why. I honestly don't know why.
What did you say about the decision not to let local health departments carry vaccines for young children?
So what ended up happening is that, well, first of all, families that normally access care access care through local health departments to receive their vaccines, which is not the ideal, but that's the facts. There's many uninsured families that have to go to their local health department to receive their vaccines. And so that supply or that access was cut off. So it became a health equity issue. And secondly, a lot of pediatricians receive their COVID vaccines from the local health departments because they don't there's a minimum dose order requirement to be able to order through the state. And many pediatricians just don't need that many. And so they would just go ahead and get what they need directly from their local health department. So it's been working out wonderfully for the COVID vaccine for older children. And so, it just didn't make any sense, that you could go to a health department with your family and get the COVID vaccine for your child that's over 5. But if your child is under 5, you can't do so.
It seems that, part of the story from the Florida Surgeon General and the governor is, we don't think it's necessary, but we'll still let parents make a decision. But when they decided not to even let the local health departments carry the vaccine, that makes it harder even for parents to make a decision. That seems like a flat out anti-vaccination position.
That's exactly right. And that was what basically my response to all of this was exactly that. This is a state that, boasts parental choice. And, you're not allowing us to be able to work with our parents to make that decision for their child. You're basically cutting off the supply. So how is that parental choice? The choice isn't going to be there for those families that have younger children.
What does it mean that a state will punish someone as qualified as you for, by throwing you off a committee that is supposed to be working to improve the health of children in Florida, just for standing up for what you believe to be based on science and true? What does that tell you about Florida today?
It's very scary. Everyone in the medical community should be scared, and everyone in the medical community should stand up, because now you're affecting the lives of the youngest, the most vulnerable. And if we can't protect our children and do what's right for our children, then we have a serious problem in this country. And, unless we all stand up and do something about it, it's just going to continue to get worse. I mean, I have never seen in my lifetime politics creep into the medical exam room like it has today.
Well, Dr. Gwynn, thank you so much for coming to Public Health on Call to tell this story, and thank you for everything you're doing for children in Florida.
Thank you so much.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.